I'd like to talk about Rett syndrome. Uh, Rett syndrome is interesting and unique to girls. Only girls have Rett syndrome. Through the years, we've worked with quite a number of girls with Rett syndrome, and they're interesting kids. Typically, with these girls, development starts off initially pretty well, and then kind of slows down, and then tends to almost come to a stop. And that development involves everything from the development of the use of the hands to walking to speech and language. And typically, most of these girls have very difficult function, very low function. One of the complicating pieces with Rett syndrome is generally you have a seizure disorder. When you have a seizure disorder, you have the inherent problems of trying to control those seizures, which essentially comes down to medication and how much medication do you use, and do you enough medication to prevent serious seizures, but not so much medication that you're impairing the development of all the cognition, the intensity of the kids. So that's a very significant piece in the global development of these girls. Uh, Given opportunities, uh, the kids can generally do, relatively speaking, fairly well, as in walking, some communication with language, development of some functional hand function. One of the most common and obvious characteristics of the girls with Rett syndrome is hand wringing. This is kind of what they do with their hands, and it tends to be almost a non-stop activity to the point that they actually, tend not to use those hands. So neurodevelopmentally, if we're working with girls with Rett syndrome, uh, we have to push sensory function because we typically have a variety of sensory issues with the girls. We have to push the gross motor function in terms of the mobility, the walking, muscle balance, muscle strength, muscle tone. We have to really push hard with the hand function, fine motor function. And as we push with the cognition, uh, we're pushing the sequential processing, which is complexity of thought, which then becomes the foundation for the language and the higher level functions. Uh, the girls tend to be very interesting in one aspect. I typically find that although the cognition may be delayed, and you might look at the global function and see it as relatively low, historically, the girls that I've seen and worked with tend to be very interested in what is age appropriate for them. For example, you have teenage girls who, maybe have very limited language, uh, but they like to look at teen magazines. They're interested in appropriate teen music, uh, and they like talking about friends, and they love going places and doing things. Uh, so it's very important, if you're working with these girls, that you don't take them on face value. Perceive them as being very unique people. Perceive them as being girls who have potentially and typical interests and typical concerns, want to be talked to like they have a brain, want to be talked to like they really understand, and treat it, if you will, normally. And integrating these girls into the family and into normal society is, I think, a very, very important key piece of this. I think if we're not doing that for them, you get degrees of depression with the girls, which obviously makes everything difficult and obviously significantly impacts the quality of their life. Relative to quality of life, we need to actively work on, getting their mobility going so that they're functional walkers and maintain their ability to walk. We want to build communication skills, basic language skills. We want to develop the cognition as much as we can possibly push and develop the cognition. And we want to impact the quality of their lives by including them in society, giving them opportunities to be engaged in and explore things that are age appropriate for them. As with so many kids, my perception is the limitation in terms of how far we have gone with such kids is a reflection of our lack of knowledge and understanding at this stage, not that that potential does not exist. So I think it's vitally important when you're working with any of these girls with Rett syndrome, is you approach each one of them as a unique individual with unlimited potential. And the job is to provide them with as many opportunities as you possibly can to realize that potential. The professional community needs to continue to perceive these girls in the same way and continue to explore and investigate and understand how can we do a better and better and better job to enhance their function and improve their futures. So again, perceive the kids as unique, provide them with all the opportunities you can, treat them as normally as you can, integrate them into the normal population society as much as you can. Again, in my experience, that makes the girls as happy as we can get them. Okay, thank you.